Hello, I'm Susan Acott and I'm the Chief Executive here at East Kent Hospitals, and today I'm delighted to have some of our palliative care team with me, and I'm going to get them to introduce themselves. If I can start with you, Lucy.
Hi everyone, I'm Lucy Rudd. I'm the consultant nurse for supportive and palliative care at East Kent Hospitals.
Terry.
Hello, I'm Terry Oliver. I'm lead nurse for supportive and palliative care here at East Kent Hospitals.
Chris.
And hello, I'm Chris Farnham. I'm one of the palliative medicine consultants in the hospital.
So the reason that we're doing this podcast is it is Dying Matters Week, but I don't really want to start without just reflecting back on some of the challenges that you've all faced during two COVID waves in looking after patients who are at the end of their life and dying quite quickly in some cases, but also the challenges for the staff involved. So Lucy, could I just start with you? And just before we turn the mic on, you were just talking about the importance of trying, and the challenge actually, of trying to create a connection with people who are in the most stressful and difficult situation probably in their lives.
As you say, Susan, it was a really, really challenging time for everybody in the Trust, and we really valued being able to work so closely alongside all of the staff on the ward. But I think we all felt that just really missing the way that we would normally connect with our patients and with their family. And I think for us as people that work in palliative care, what we really want to do is make a connection with people. We want people to feel that they're valued at that point, even at the point when you're dying. We want you to feel that you are valued for being you, and that you are, you matter, you're really important. And so much of how we do that and how we get to know people is that we know the people that are important to them, and we ask questions about what they were like in their life and the kind of people that they were. And it was just so difficult to miss all of that, and to obviously everybody tried their best in talking on the telephone and using iPads and doing all kinds of things that we've never done before, but it's not the same as having somebody there with you to say, well, this is my husband, or this is my wife, or whoever it was, and this is what they were like. And to be able to share that moment, so that even in their last moments in life, both they and the people that are important to them felt that they mattered and they were important. And I think that's so valuable for people, as they then, the people that you leave behind are the people that have to keep going when dealing with the grief and their loss. We really missed that, and it was really difficult for us and for staff on the ward and for so many people.
Yeah, and Terry, just in terms of that issue around supporting the staff, so in COVID we also had quite a lot of staff who probably were experiencing more end-of-life situations and deaths amongst their patients more than normal. Mm-hmm. So can you just say something around the challenge of supporting the staff during COVID?
I think, we never imagined the enormity that this was going to be. And a lot of the staff working on the wards with a lot of patients who were dying from COVID were actually redeployed from areas where they would never have so much contact with people who are dying. So for them, it was a whole different way of working. And they were really keen to get it right, of course, but people did deteriorate really rapidly. And some days there would be a lot of deaths on the wards, and you could just see the staff crumbling with that. So it was a lot of our work was actually supporting those staff, and I think they found it really valuable that we were actually taking the time. How are you? Not just how are your patients. How are you coping? And making sure that if they were struggling, that and they needed more than just us to support them, that then there are lots of opportunities out there. Mainly through the Trust and virtually, where we could actually help them. And it's just making sure that they access that and that it doesn't become a longer term stress for them. But I have to say I think they all did remarkably well, particularly those staff who were not used to dealing with these kinds of things in their normal daily life.
Mm. And Chris, welcome to East Kent. Delighted to have you. And you are new to us, and we're going to benefit greatly from your experience, I think. But did you feel that that anything changed during COVID for palliative care teams? I mean, did you learn anything different? Did you think about solving some of the challenges in a different way because of the constraints of COVID?
Well, so yes, it's very prescient. I've been a consultant for 20 odd years, and I've never practiced palliative medicine like this. I wasn't trained like this. As Lucy alluded to, we usually have the luxury of getting to know people a little bit. I think when you're called to see people in the emergency department who you know are going to die in the next hour or two, it may be a husband in one bay and a wife in another bay, and they're both dying. We'd never seen things like this before. And in one occasion, I remember there was a mother, father and son all dying together. And suddenly having to deal with that, where you knew that you had hours to look after them rather than days, and to make sure that they had a dignified death, that they were comfortable, that the staff who were looking after them felt comfortable as much as could be, that their spiritual needs were being met, and that family who couldn't be with them, who must have been absolutely distraught in most cases, were somehow part of that process. In a system where your bleep would be going and there'd be 5 other people who are in a similar situation, and how do you make sure that they equally were going to have the same dignified death, was something that none of us had ever recognised or experienced before. However, what we did find was that we were finding relationships with acute physicians, with oncologists who were redeployed, with gynecologists, with surgeons. Suddenly you were getting to know people who you would never normally know, and they were picking up the baton and running with it. So they were going off and learning a little bit of what we taught them and managing those patients very effectively, people talking to relatives as their relatives were dying, so that they knew exactly what was happening at that time. It was an amazing thing that people absolutely rose to the challenge. And I think the big challenge now is going to be, as Terry's alluded to as well, is what the legacy of all of this, both for patients and families, and what memories and experiences they have to deal with, but also for staff as well, going forward.
So this week is Dying Matters Week, and I guess just in the way that you've described, Chris, with so many more people being very directly involved in the last few hours or the last few days of somebody's life, how do we allow death to be talked about in a more positive way, and how do we use that experience? What would you want the good legacy of COVID to be, Lucy? What's your vision now and your thoughts?
I think, Dying Matters Week is really just about talking. It's about being open to having a conversation about death and dying, and realising that it's not a scary taboo that we can't talk about. And I think we've all experienced so much more death and dying this year than any of us would have imagined, that I really hope our legacy is 2 things, is that we keep working together, as Chris said. We work together with everybody in ways that we never have. So just coming together and talking are the things that will really make a huge difference. And this week is all about what it means to be in a good place to die, and we've thought about that quite a lot. And I think it always, however you interpret being in a good place to die, it always comes back to talking and planning and sharing your thoughts and your wishes. So that's so important, and I think if that could be our legacy, that we talk more and that we work together more, that would be amazing. We just really want everyone at the Trust, whoever you are, whatever you do, to be open to those conversations.
Yeah, I mean, sadly I've lost both my parents, and I think that the issue is, if you have a good death, that stays with family, and if you have a bad death, it stays with family. It's something that people never ever forget, is it? Chris, in terms of what you would want your colleagues to have as a legacy, and what you as a team want to kind of give to the patients, the families and the staff who will have to face this inevitable situation, what's your thoughts now?
One of the things that I clearly am very passionate about is this true holistic care of our patients. And we're not very good as doctors at talking about death, because we feel that we failed somehow if we allow our patients to die. But actually allowing our patients to die well, and that means dying in a place where they've got some choice as to where they die, needs some planning. And I think it's really beholden on us as doctors to ask people about the future and what they think about the future. Most patients, when they've got a terminal illness, know they're dying. And to be given that opportunity by their doctor to talk about it, and then to be able to be part of the process of planning, so that husbands, wives, children, it doesn't all fall on them at the last minute. I know when my own father died, ridiculously, for exactly this reason, I hadn't spoken to him about it. So he ended up dying in hospital where he didn't want to die. And I thought, goodness, here I am, I tell everybody else what to do and I can't do it. So, we've all got people we love And there are things that we really need to do to make sure that when it is our turn, and it's not if, it's when it's our turn, that we're able to do the right thing, not just for our patients, but for our own families as well.
And Terry, what's your thoughts about what you want your team to do? You must be very proud of what your team did in COVID.
Yeah, absolutely. They're a fantastic team, and we have expanded. And we've had to all learn very, very quickly. So they are a fabulous team. They're flexible, they're very keen to make sure that patients' end of life is as best as it can possibly be, alongside looking after the staff. Our team has changed in that we are more easily recognised for our skills since, particularly through COVID, and now talking about Dying Matters Week. It is about us helping those doctors and nurses on the ward facilitate conversations, because it's not easy for them. But I think if we can just increase the amount of conversations around dying, that just does make your job a lot easier and a lot more comfortable. And I think everyone would be surprised how easy it is to talk to somebody with a slight introduction. Somebody who's dying, they want to talk about what they want at the end of their life. They're waiting for somebody to ask them. So I think as a team, my fabulous team, it's us facilitating those conversations that's so important, and yes, I am very proud of them.
What you're saying is more to do with confidence really than anything. What would you sort of want as a message and people to really think about this week?
Well, I would say just talk, just ask. And if you don't feel comfortable, ask us. So we're here. So as Terry said, this great team that I've joined, we're now working 7 days a week. You can speak to one of the consultants 24 hours a day, 7 days a week. If you don't feel confident, and there's no reason why everybody should feel confident, if this isn't your bag, then ask someone who it is. We can come and see you, we can give you pointers, but ask. So it sounds corny, people only die once. We can't rewind the clock and have another go at it. And it's so much easier if you just ask, and then we can help you, or we can come and do it if you can't do it. But ask, and that's asking the patient, or you ask the palliative care team.
So we only get one chance to do this well, and just ask. Lucy, what would you say?
Just today, Dying Matters released some research that shows only 13% of adults have had a conversation with someone important to them about where they want to die. I mean, that's just such a low figure. Please just start a conversation. If it's important to you, tell the people who are important to you, tell them. If we don't talk about it, then we won't know. And yeah, we have one chance to get it right. So let's all work together to do that.
There is something around with with COVID. There is a legacy of making people a bit less on the stiff upper lip and just a bit more connected and perhaps a bit more willing to talk about something which, as you say, is a matter of when and not if. Well, thank you very much for joining me today. Really appreciate that, Terry, Lucy and Chris, and I hope that this podcast helps people to do what you've said, to talk about dying with their loved ones. And if they're really unsure, we know where to find you, and we will call you and ask for your assistance and your help. But I'm very grateful for your time today. Thank you very much.
Thank you.
Thank you.